Okay, good afternoon again to everybody joining. I will give a brief overview of the Haiti Health Network for the first couple minutes while people hop on. We really thank you for joining us today for this webinar about rehabilitation services in Haiti. I know personally when I was living in Haiti and working in Haiti, this was something that we were frequently searching for our patients, and was always a huge blessing when we found it, but always not so easy to find. So I'm really excited about everyone sharing from different regions of Haiti to help create awareness of what's available, and then also sharing with us about the educational opportunities that are available in the different associations. So I really personally, I love this topic, and I'm really excited about sharing it with everybody. Before I turn it over to our moderators, I just want to share a little bit about the Haiti Health Network. It was formed in conjunction with us. As an introduction, my name is Barbara Campbell, and I'm the executive director of the Dalton Foundation. And we have been funding some health system strengthening projects in Haiti for quite a while. I lived and worked in Haiti for about 6 years, and that's where I got my passion for this. And we started the Haiti Health Network with some other physicians. Currently, we have over 500 members, and our goal is to do educational things like this. We've also been doing a lot of supply chain procurement, a lot of other things to just assist healthcare in Haiti. We're working on a large scale data collection project to get capacity, healthcare capacity information for the country of Haiti that we are sharing with funders in hopes of bringing funds into the work that's going on in Haiti. So that's ongoing. And we are excited about some of these programs getting started in the areas of medical equipment, and some supply distribution that's going on. So we do have a website. You can see that's the landing page I've got there. It's HaitiHealthNetwork.org. And it does have ways for you to search our searchable online database of where healthcare facilities are. And then it also has ways for people to get involved. It shows you how you can join the Haiti Health Network. You can join one of our specialty groups. We could look to start another specialty group after this webinar for rehabilitation services if there's an interest. There's ways to post different events on this calendar. If you do post an event, it goes live right away. So you can share the work you're doing in any events. So I just wanted to create awareness that this exists. The site is translated into French and Creole as well, so you can see it in multiple languages. And then lastly, real quick announcement, we do host a coronavirus COVID-19 call every Monday night. We've been doing it since March, and we'll continue doing it as long as necessary. We are very encouraged right now that there's not a lot of discussion of it in Haiti and not a lot of cases being seen, so we're very excited about that. But we do still host this call every Monday night. If you're interested in joining that, we welcome you to that as well. But today I want to get on to why we're here, into the topic of rehabilitation services in Haiti. As I said before, I think this is a really important topic. I think it dramatically affects the quality of life for people that are suffering with some of these chronic conditions, and absolutely necessary to create awareness about it and connect people to the services. So today we're going to start out getting a little history about some PT and OT in Haiti. We're going to go through the various professions and specialties, their role within MSPP, some of the educational requirements. We're going to hear from some professionals that are working in the field, and then we'll talk about ways to find resources, healthcare resources for your patients. Here's a list. We're so blessed this time to have such a great list of moderators. So really thrilled to have everybody with us today to share. And our moderators, I really thank Janet O'Flynn and Sibyl Bielman for organizing this. You've done an amazing job of getting this all together, and they will be your primary host today as we go through the webinar. I'm going to quit sharing my screen now. A couple housekeeping items. If you do have questions, you can type them in the chat or in the Q&A box. you can raise your hand. I think the format we're going to do, we're going to start by, I'm going to turn it over to Seville, and she's going to share a little bit of the history of OT and PT in Haiti. And then Dr. O'Flynn will be leading some discussion with our various panelists, asking them some questions about their work. And then we do want to have plenty of time for integrating in questions and hearing from everybody that is attending. So without further ado, Sabine, I'm going to turn it over to you. I'll have you unmute yourself and share with us some of the history of OT and PT in Haiti.
Thank you, Barbara. Good morning, good afternoon, everyone. Thanks very much for your introduction, Barbara, and thank you thank you Haiti Health Network to give us the opportunity to have this webinar on rehabilitation services in Haiti today. I've seen in the group of attendees that there's a lot of our panelists colleagues present, so I'm super excited, and I think we'll have a great discussion after our presentations. Like Barbara mentioned, her experiences within Haiti, having difficulties finding rehab services for their patients, I think that has to do, and that's how I'll get to the history of rehab in Haiti, to the fact that in a lot of low and middle income countries until today, rehab services are quite scarce, and rehab as a medical field is often still unknown and not a priority for a lot of people. And we see this still in Haiti today, even if for a long time there have been rehab services within the country, often on a private basis or organized by NGOs. And I think we all know that the importance of and the knowledge of rehab grew a lot after the 2010 earthquake in Port-au-Prince, and that's where a lot more rehab facilities and services, obviously with the help of different NGOs as well, popped up. But still, until today, mainly in the larger cities, or let's say in the Port-au-Prince area, maybe in the north in the Cap-Haïtien area, but they're still quite scarce, and rehab is still not accessible for all or for everyone that needs it. And one of the main issues we see today is that rehabilitation as a medical field is not yet integrated in the national health strategy that or the national health plan of the Ministry of Health. And maybe in our discussion at the end of our presentations today, we'll have a little bit of time to talk about how people attending or my other presenting colleagues, how we could move forward to make that possible at some point, and how we could move forward to integrate rehabilitation as a medical field into the National Health Plan. That is a little very short introduction on the history of rehab in general in Haiti. And now I would like to hand over to Janet.
Hello, thank you, Sabine. I don't see our first presenter yet. He may be joining us later, Dr. Payan, the first Secretary of State for Integration of handicapped persons with handicaps. He's now working with Société Haïtienne d'Aide des Aveugles, but I hope he will come in a little bit. I'm going to move on to a discussion about the professions in Haiti, the professional associations. And for this discussion, we have some pioneers. We have Mario Pasque, who is the rehabilitation technician, Consuelo Alzamora, occupational therapist or ergotherapist, David Charles, physical therapist, and we are going to have those people talk about what it's been like to be a pioneer in Haiti. But specifically, I have a question for each of them. First of all, for Mario Pasque, President of the Haitian Association of Assistants in Physical Therapy. What is a rehabilitation technician? Where do they work? What does ASHATP, what do you do in the association? Mario.
Okay. Good morning, everyone.
Good morning.
So I'm very happy to be here today in order to participate with this webinar. So first of all, to introduce myself, my name is Mario, and I'm the president of Haitian Association of Technicians of Physical Therapy. So about your first question, you said that who is a rehab technician? So a rehab technician is a healthcare worker who has been trained over a maximum period of 2 years and of theoretical and practical training. So as rehab technician, we have been trained about a lot of subjects as anatomy, myology, osteology, and various pathology in order to become a good professional to work with human being who get trouble or problem with neuromuscular skeletal. But a rehab technician also is an agent of promotion for physical therapy, and he also has a particular attention for people who are in disability or people with reduced mobility. So a rehab technician is a healthcare worker who has been working who work with people with a physical therapist in a rehab center. Do you hear me?
Yes. Yes. Thank you. Keep going.
Okay. And about where a rehab technician work. So normally they work in a rehabilitation center and hospital that has physiotherapy services. And they work also in private clinic. So for those who get more experiences in the field, they used to work also at home patient for rehabilitation. But there is one thing to know about rehab technician where they work. They work with the support and the supervision of a physical therapist. And the physical therapist and the rehab technician are partner, and they work closely together. So they can work wherever there is a rehabilitation center and a hospital that has physical therapy services. And the last question was what ASAP used to do.
Yes.
Normal, okay. ASAP have been created since 2015 group all the rehab technician, because after the formation we decided to put us together in order to promote rehabilitation in Haiti. So about the activity that we have done, so we have worked with people who has disability, and we decided to create the association in order to promote rehabilitation first, and after we used to do awareness raising on different pathology and primary school and communal and on the area on the country in order to promote rehabilitation and to help people to know what is the association in the field. And in a conference that was held in South Africa and Switzerland about the association that we are talking about, what we have done during our existence in Haiti. So we are a new association, but we don't have all autonomy to do what we want to do. But we do our best to stay connected and to promote rehabilitation.
Mario, this is Janet talking. When
Okay.
you were very clear for the first two parts of what is a rehab technician and where do they work, when you started to discuss the association, the sound became slow and distorted. I wonder if we can come back to you on the third part of that question when maybe the sound will be better.
Okay, no problem.
Okay, so the third part, what does the association do? We'll come back and ask you that again, if that's okay. Okay, don't leave.
Yes.
Okay, thank you.
So
let's go to Consuelo,
yes.
and we'll come back to you, Mario. Thank you.
Okay,
Consuelo is the recent president of AGEO, which is the Asociación Haitiana des Ergothérapeutes, or Haitian OT Association. She is also a pioneer in OT or ergotherapy in Haiti. She also is the head of a clinic in CAI, which is Fondation Tous Ensemble Fontaine. So I have a question for you, Consuelo. What is an ergotherapist or an OT? Where do they work? What does AGE do? And also please talk about the challenges of running a rehab clinic in Haiti. What are the challenges you face?
Hi everyone, my name is Consuelo Zamora. I'm a Chilean OT. I have been serving in Haiti for already 8 years as an occupational therapist. And I'm too the director of Fundación Tous Ensemble, that we have a rehabilitation center in Okai, in South Haiti. So today I was the ex-president of the Asian Association of Occupational Therapies. Today I want to talk like very, my connection is okay, can you hear me?
Yes, we're still good.
So just a little about what is occupational therapies. I know a lot of people hear about it, but not a lot of people understand what we do. So we are a health profession. We promote health and well-being for people, and we base our practice in occupations. So what is an occupation is a daily life activity that has meaning and purpose for the person. It's not just any activity. It needs to have purpose and meaning, and it's set in a time and in a context. We have different fields where we work. We work in with people, with communities, with families. We work with people that have impairment of the body structure, like health issues, conditions. We work with people that are restricted in their participation, in their social participation. We work with groups that are socially excluded, and we work too with cultural minority groups. That means, like, for example, we can work in prisons, we can work with people with mental health issues, we can work with people that, migrants that are excluded from the community, we can work with people that has problems with alcohol, with drugs, and so on. So we work a lot with participation and how people can have a balance in their occupations in their life. So here in Haiti, we are more focused. Our work is more focused in physical rehabilitation. So we work together with physical therapists, occupational therapists, technicians in physical rehabilitation. We haven't opened a lot of fields in the community part and in mental health part. I don't know if it's everything clear. Yes.
Yes, we can hear you. That's good.
Okay. And the Asian occupational therapy started in 2016. when we participate in the World Federation of Occupational Therapies Council in Colombia. So we are part, like active members of the World Federation of Occupational Therapy.
Excuse me, Consuelo. Dr. Payon, welcome.
Okay, yeah.
Bienvenue, Dr. Payon. Nous sommes maintenant avec Consuelo Alzamora. Après ça, pouvez-vous donner votre présentation? Nous attendons pour Consuelo Alzamora pour finir. Ça, c'est OK? Vous n'avez pas votre micro. Le micro n'est pas actif. OK, Consuelo va continuer. Après, nous pouvons avoir votre introduction. Ça, c'est OK?
Oui, j'entends là maintenant.
Okay, good.
OK, good. Thank you. Consuelo.
Okay. So we have been participating with the World Federation of Occupational Therapies in 2016 in Colombia, and we have representing too in South Africa in, I think, like 1 year ago. So we have been like, yes, representing in those congress. We try to bring OTs together. We are not a lot of OTs. So Dr. Evans is the first occupational therapist in Haiti. He will talk later. And when we start our association, we were just 5 people. And now we are in between 20 with the students of occupational therapy. We do advocacy for occupational therapy, education. We try to open spaces like to work. And we participate, as I already said, like in in World Federation and in the ACOT, that is the Association of the Caribbean of Occupational Therapists. And yes, should I continue with the challenges or later?
Yes, please, you can talk about what are your challenges in running your clinic, Fontaine, in Kai? What are the challenges for a rehab program in Haiti?
Okay, yes, I did like a little list too about our challenges as rehab professional. I think maybe later we can discuss with other participants and our colleagues. Yes. And the challenges as rehab facility. So to start, like as rehab professional, I think that it's a lack of continuing education. So it's very difficult for us to do like a master's degree or a doctorate or even like a diploma or have like small courses here because there is no any entity that is available. We are not well known by other health professionals like doctors, nurses. So a lot of people, they don't know what is rehabilitation and what is a technician, what is an occupational therapist or a physical therapist. There is too a need of jobs. I think there is a lot of jobs, not a lot, but there is jobs available. But I think there is can be more, and some of the new PTs are having difficulties to have work. The School of Rehab Technicians, the 2 other schools that are like Handicap and Loma Linda, they closed because there were not a need. There is a need, but there are not jobs, so there are not positions for them. And that our professions are still not recognized by the government. So we as health practitioners, we are not recognized by the government. I think that's some challenges that I see. And as rehab facilities, that rehabilitation is something very expensive, like to run a clinic, like the electricity, the people, the equipment, everything. Not a lot of people in Haiti can pay the total cost of an intervention. That means, for example, us, we are a no lucrative clinic. So the patient pays in between the 10% of of the total cost of the session. So we need to find funds to pay the 90% of the treatment session. The materials, for example, we have a P&O shop, a prosthetics and orthotics shop. The materials are very expensive and they are not available in the country. So we have to buy it in the States. That is like more cost for us, and people doesn't have the money to, not the 100% of the money, but not the 100% of the people, sorry, but the most common people, they don't have the money to pay for a prosthetics, like for the full cost of prosthetics that can be like, I don't know, 1,000, 2,000 US, or an orthotic. So we need to find money to help them pay. There is not a lot of knowledge, the same like what is rehabilitation from part of other professionals. So doctors are not sending people at time, like people that had a stroke, kids with disabilities, like they don't, the people when they go to get the vaccination, the nurses, they don't see that the kid, I don't know, can hold their head or can sit when they are like 8 months, or so they don't know, or they see something wrong, but they don't understand that the place to send that kid is to rehabilitation, to therapy. Another challenge is that we have a lot of lack from support from the government. For example, we are the only center, not the only, sorry. We are one of the centers of rehab in the South, but we see in between 50 to 60 patients, sometimes 60, 70 patients per day. And they just pay the 10% of what costs us for a treatment session. And we don't get any support from the government. And the government doesn't have like a therapy in the general hospital, like a government facility that can, so we are, for me, like we are doing their job. And when we go and have conversation with them, I'm like, okay, but maybe you can like, how do you say subvention? I don't know, like help us.
It's just support or give a grant.
Yeah, like for us, because we are helping like the community, but there is not available anything for us. And sometimes we find that the NGOs, like in country too, yes, the NGOs that are in country and that know the work that we do, and it's not just my clinic, I know like other clinics, like they don't support them too. Like sometimes they have funds, but they are not available for us that we have like rehab centers in the country. And there is not a lot of grants like internationally to like focus for rehabilitation. A lot of them, like, you know, everyone is founding like kids and women. But what about old people, old with strokes, like a stroke patients and men?
Consuelo.
Yes.
You have a wonderful presentation, but we have to get some other people in. I have a note here from June Hanks. She's wondering if you have a structure set up so a US organization could sponsor. Maybe you can put that onto the chat. If people do want to help sponsor the organization for Fontaine, can you put your email or your website on the chat so that people can add that if they have resources to bring to your clinic?
Okay, great. Thank you, June. Yes, and then at the end, I think it would be great if everyone can share the challenges too, so we can hear.
It's really important what you're saying. It really is very important to know that.
Yeah, Bill, thank you.
Our next person was going to be David Charles, physio. David, if you could please wait till we hear from Dr. Payan. I'm not sure if he's able to stay the whole time. So Dr. Payan, I'm glad to have you here. I didn't even ask you in what language you would like to present. Would you like to present in English?
French.
Okay. May I give you a question to answer? No.
Bon, ça dépend. Mais moi, j'ai une présentation à faire.
OK. Vous voulez présenter en français?
Oui, oui, oui. Pas de problème.
OK.
Ça vous dérange, non?
Nous n'avons pas préparé un traducteur. Je ne sais pas si Sibylle...
Oui, mais je vous avais dit que j'allais présenter, que ma présentation sera en français. Je vous avais dit ça.
OK, non, ce n'est pas un problème. OK, Eleanor Leiden est volunteering. Je parle français et peux traduire. Je travaille comme professeur. OK, Eleanor, vous êtes là.
Et puis c'est très court aussi. Ma présentation est très courte.
OK.
Short presentation.
Eleanor, can you put your speaker on, your microphone?
I will have to let her in. It'll take me just a minute to get in there, so give me just a second, okay?
Okay, okay. I would like to take a minute to present Dr. Payon. Dr. Payon was the first Secretary of State for the Bureau de Secrétaire de l'État pour Intégration des Personnes Handicapées. And he is now the director of SHA, Société Haïtienne d'Aide des Aveugles, SHAA. SHA is an advocate agency for people with low vision and blindness, but in addition to that has a much wider platform, which is to advocate for all people in Haiti with disabilities. Dr. Payon was the first author, the primary author for the Loi portant l'intégration des personnes handicapées in 2012, which is the Handicapped Access or Handicapped Human Rights Law. And that law has many sections that have to do with different aspects of life of a Haitian citizen who may have a condition of handicap, a situation of handicap. One of the things I would like him to talk about today is we have training in rehabilitation is mentioned in the law, Chapter 3. At the time that the law was written, there was not really the access to the professions of OT, PT, rehab tech. Those professions have come up since then. ONP, orthotics and prosthetics. So one question I would like him to address is, will we need to update the law, or can that existing Chapter 3 apply to access to people who need to have those services? And now you can take it away, Dr. Payon.
OK, donc, Mrs. O'Flynn, c'est vraiment un plaisir pour moi.
Okay, it's a pleasure to be here. Cher docteur, si vous allez doucement après 2-3 phrases que je peux traduire. Merci, monsieur. Merci.
Donc, c'est un plaisir pour moi d'être avec vous ce matin. Et ma présentation va être très, très courte et axée sur la loi portant sur l'intégration des personnes handicapées.
Okay, so he is honored and it's his pleasure to be here, and his presentation will be brief and will be centered on the access to this law that Janet just mentioned about access to human rights for people with disability.
Première chose, c'est que la loi portant sur l'intégration des personnes handicapées est intimement associée à la lutte du secteur organisé des personnes handicapées pour leurs droits et leur dignité. Ce n'est pas une loi qui est tombée du ciel.
Okay, so he says this is not a superficial law. It's intimately corrected to the rights of all people with disabilities, and you know, it's really a core law for them.
Et cette loi aborde différents sujets, différentes thématiques.
Okay, the law, pardon, excuse-moi. The law addresses several different areas.
Subjets.
Goals, pardon, the goals.
Différents aspects, différents, par exemple, sujets de l'éducation, l'accessibilité, mais aussi la réadaptation.
So it also, j'ai pas entendu très clairement, si vous pourriez répéter, s'il vous plaît.
Non, j'ai dit que la loi portant sur l'intégration des personnes handicapées traite de différents sujets, such as education, accessibility, etc., etc.
Right. So it addresses many different areas such as education, accessibility, inclusion, etc., like we all know.
And also la réadaptation.
And also readaptation, which is rehabilitation.
Bon, la réhabilitation est abordée sous 3 angles. 1, la formation. 2, les soins. Et 3e aspect, c'est en situation, ce qui doit se passer en situation d'urgence.
Okay, so there are three, the rehabilitation takes place in 3 different aspects, 3 different angles. One is the training, the second one is the healthcare, the actual treatments, and the third is, pardon, j'ai oublié, excusez-moi.
La situation d'urgence.
Oh yeah, and emergency situations, the critical situations, right, hardships and critical information. Merci, monsieur.
D'accord. Concernant la formation, c'est clairement dit à l'article 16 de la loi que dans les programmes de formation des médecins et dans les facultés de médecine, dans les écoles de sciences infirmières, dans les programmes de formation, on doit inclure des cours en réadaptation ou réhabilitation.
Okay.
C'est clairement mentionné à l'article 16.
Super. In Article 16 of the law, it states that all the healthcare programs, such as nurse training, medical training, any healthcare profession, must include a course on rehabilitation.
Alors, Madame Ophim m'a posé hier une question provocatrice, mais à cette question, je réponds par une question aussi provocatrice. Est-ce qu'on peut demander à une faculté des sciences de réhabilitation d'inclure dans son programme de formation des cours en réhabilitation? Ceci est évident. Vous comprenez, ce serait un pléonasme.
Okay, so he says that he was asked a provocative question and he was going to answer it with a provocative question, which is whether the faculty for rehabilitation can be asked to. Alors là, je ne suis pas très claire encore si on peut inclure.
Est-ce qu'on peut demander?
Oui.
Can we ask?
Oui. Demander, je comprends bien, oui.
Oui, est-ce qu'on peut demander à une faculté des sciences de réhabilitation d'inclure, d'inclure dans son programme, dans son curriculum de formation, des cours en réhabilitation?
Okay, so can we?
C'est évident.
Right. Okay, I admire Dr. Payon's sense of humor. He's fantastic. He says, is it reasonable to ask the faculty and a department in rehabilitation and science of rehabilitation to include a course on rehabilitation? And he says, there, is that reasonable? So there, I guess, is a bit of a problem. Très bien.
D'accord. Donc, c'est évident. Et deuxième angle, ce sont les soins, c'est-à-dire l'accès aux soins de santé. À l'article 17, l'État exige que dans au moins un hôpital par département, on doit avoir un personnel médical, un personnel infirmier, de même que les infrastructures nécessaires au dépistage, aux soins et à la réhabilitation. C'est-à-dire dans chaque département, on est supposé avoir ce personnel et le matériel et les infrastructures nécessaires.
Oh, okay, beautiful. So Article 17 of the law says that in every hospital there should be in at least one designated person in each department who is responsible for screening for rehabilitation issues, the need for rehabilitation. Est-ce que j'ai bien dit, monsieur?
Oui.
Merci.
At least one hospital.
Oui.
Per department should have that.
Yeah,
Okay.
so that you've got an entry into their screening, and this is an issue that is seen and noted.
Okay. Maintenant, à l'article 19, il y a une chose qui est très importante. C'est qu'il doit y avoir dans tous les centres, dans tous les hôpitaux, les centres de santé du pays, un service minimum de santé gratuit. Free. OK?
Oui, très bien. So
Par exemple,
right.
Et les dépenses effectuées sont déductibles des redevances fiscales. Qu'est-ce que cela veut dire? En Haïti, comme partout dans le monde, les personnes morales ou physiques doivent payer des taxes. Tout le monde doit payer des taxes à la DGI. Si par exemple, une personne morale ou un hôpital doit payer $4 000 pour un an, si cet hôpital à dépenser 2 000 $ pour des personnes handicapées en situation vulnérable, à ce moment-là, ce taux total ou ce centre de santé, au lieu de payer 4 000 $, 4 000 $, il va payer 2 000 $ puisqu'il a dépensé 2 000 $ pour les personnes handicapées.
Voilà,
en
c'est un
situation
décompte.
difficile.
Oui, c'est un décompte.
C'est
Voilà.
exact.
Exactement. Okay. So Article 19 is very important as well. It's in all the clinics or the health centers, could be a clinic, hospital. There should be a minimum of free services provided to people with disabilities for rehabilitation. And that it also provides for a law because all health centers, clinics, hospitals have to pay a tax as it's called a moral person. It's an institution. They pay a tax. So they are entitled to a rebate or a discount on a tax exemption. So the example that Dr. Payan gave is that if you need to pay an annual tax of $4,000 per year, and you have spent $2,000 in providing services to the impoverished and the handicapped, you will then only pay $2,000. So it's a tax rebate.
Oui. Discret. Bon. Maintenant, troisième aspect, c'est les situations d'urgence. C'est-à-dire les situations lorsqu'il y a des catastrophes naturelles, comme par exemple les épidémies, la pandémie, exemple, la COVID-19, par exemple. Donc, dans ces situations, il y a des mesures obligatoires à prendre. Premièrement, on doit recenser les personnes handicapées, leurs parents et les accompagnateurs. Ces personnes, au besoin, doivent avoir de l'assistance psychologique. On peut aussi offrir des services de psychothérapie collective, des séances au besoin. Donc, et si les personnes ont besoin du matériel adapté, comme fauteuil roulant, canne blanche, de même que prothèses, orthèses, tous ces matériels doivent être donnés sur une base gratuite.
Très bien. Docteur, c'était quel article, cet article? Le 20? C'est
dans le chapitre 12
oui.
De la loi, chapitre oui. 12, articles 72, 73 et 74.
Okay, so in chapter 12, in article 12, 13, and 14.
72, 72,
oh, pardon.
73, and
wait,
74.
There's 70, sorry, in Article 72, 73, and 74, there's a provision for natural disasters, of which, earthquake, pandemic, for example, this pandemic, earthquake, pandemic, tornado, etc. That if there is such a natural disaster, that the people with disabilities will be counted. There will be a census of them, plus their caregivers, and then they will be eligible for care such as psychotherapeutic support. There will be a provision for perhaps psychotherapeutic groups, so that mental health support as well. And if they have lost their prosthetics in the disaster, then they would be provided those prosthetics replacement for free. So it's a very important catastrophe clause.
Le drame qu'on a, c'est que ces articles ne sont pas en application en Haïti.
Okay. and of course
D'ailleurs, hier, c'était mercredi 29, on a eu à l'achat une conférence de presse pour dénoncer cette situation. Parce qu'on a même élaboré avec le pasteur Lemaitre Zéphir une pétition où on a collecté 2022 signatures pour demander au gouvernement haïtien d'accorder une attention prioritaire aux personnes handicapées et aux personnes âgées dans la gestion de la crise coronavirus.
Excellent. Okay, so the problem currently is the big drama in Haiti is that these laws are actually not being applied and enforced. And so they recently circulated a petition. They got 2,200, 2,022 signatures on a petition, which they've submitted to the government to ask that they really make this a priority for people with disabilities and also the elderly who are disabled by some of their elderly issues.
And Dr. Payan, can I say something as well? This is Janet. I so much appreciate your presentations at our school to the rehab students, because what you have done is put the emphasis on not just educating the government and the providers, but that every provider is responsible for educating a person who has a situation of handicap. What are their rights? self-advocacy is going to become something very much key to getting this law enforced. I appreciate that, the way you taught that to our students. And I'm going to have to ask you if we can give you one more minute so that
Oui,
we can...
non, mais j'ai presque fini. Je voulais seulement dire, comme l'a dit un juriste anglais, il n'y a rien de pire pour un État que de légiférer et de ne pas faire respecter ses lois. Merci.
Okay, and his concluding comment is that the worst is that the government is not really respecting this law. There's a lot of work to be done. Est-ce que j'ai bien dit, cher
Non,
monsieur?
alors c'est ridiculous, you know, for a state to have laws and to do not respect the laws.
Yeah, right. There's no respect for the laws. It's not being enacted. It's not being enforced. It's not being applied.
Okay, donc thank you.
Merci, monsieur. Excusez-moi pour ma mauvaise traduction.
Merci, Eleanor. Thank you so much.
De rien.
I love your French accent. It's a beautiful thing. Thank you. And I love, of course, Dr. Péon's voice. It has good humor and good human warmth in that voice.
Ouais.
Thank you, Dr.
Et pour
Péon.
moi, c'était un plaisir, docteur. Vraiment un plaisir. Merci bien.
We are going to move to David Charles, who may be able to talk a little bit more about the government role, because he's working with Bset, the Bureau de Secrétaire de l'État pour Intégration des Personnes Handicapées. And I would, David, are you available there? Let me ask you your question. David Charles is a physiotherapist. He was the founder of Société Haitienne de Physio, which is now shortened as SOAF. He was a first director, I think, of the Adaptive Equipment Bank at Bset, which is the government agency for inclusion of handicapped persons. And he is, I've lost track, I'm sorry, David, of what your role is now. You have a leadership role in that bureau, and I'm sorry, I've lost the title in my mind. Also, David teaches at UNIFA and at UNEF, the two physical therapy programs. David, you can put your video on if you like.
Okay, I'll try to, thank you, Janet. Thank you for this opportunity to present in this webinar. As you said, I'm David Charles. I am a physical therapist, one of the pioneers of the Société Haitienne de Physiothérapie, and also I'm the former Bank of Adapted Materials Coordinator, and now I'm working as the coordinator of the Rehabilitation and Social Inclusion Department for the Bureau of the Secretary of State for Integration of Persons with Disability. Today, I'm pleased to talk to you about the assistive devices and the technologies, the opportunities and the challenges for Haiti. To let you, for a better understanding, I will use the definition of the International Classification of Functioning and Disability and Health for the assistive devices. They define the assistive product and technology as any product, any instrument, equipment, or technology adapted or specially designed for improving the functioning of a person with disability. In the other hand, the International Organization for Standardization defines assistive products more broadly as any product, especially produced or generally available, that is used by or for persons with disability for their participation, for their protection, for their support, to train them for measurement or substitute for body function and activities, or to prevent impairments, activity limitation, or participation restriction. Then, what are the purposes of the assistive devices? The primary purpose of the assistive devices and technologies is to maintain or improve an individual functioning and independence to facilitate participation and overall the well-being. Let me give you some example of assistive devices and technology. Those include the wheelchairs that you see all the day, the prosthesis, the hearing aids, the visual aids, and specialized computer software and hardware. Is not only the as we used to see people considering it. It's not only the mobility devices, it's more than that. The mobility devices are include when we are talking about assistive devices for person with disability. For example, we have different group of mobility devices. As for the mobility, we can consider wheelchairs, the canes, the crutches, walkers, or the walking frames, the walking sticks, the tricycle, as we used to have the pet cart here in Haiti, the white cane that the person with visual impairments use, the prosthetics, the club foot braces, those are for mobility. For vision impairments, there are the eyeglasses, the magnifiers, the magnifying software for the computers, the white canes, the bright machines, even the talking watches, the talking calculators, and some of communication cards, they are considered as assistive devices for the person with disability. For those who have the hearing impairments, we have the hearing aids, the hearing loads, the hat, including mobility, hearing, vision, or communication capacities. So now, what are the opportunities and the barriers to have access to the assistive devices and technology in Haiti? So as Dr. Peya have been explaining a few minutes ago about the law in Haiti, that's an opportunity. But as I said, the law are not respected here in the country. And otherwise, there is other difficulties also that we can consider as barriers. I will mention a few of them. The first of all is the lack of awareness. It's more than a simple lack of the purpose of the assistive devices and technology. The society, the Haitian society, even the medical professionals are not really aware about the role of the rehabilitation professionals and also about the need of persons with disability in the country. This is the main barrier we have to face with. This is also for that reason the promotion of the rehabilitation services and professions is really, really important for this country. Otherwise, we can consider also the lack of governance, including more legislation, more policies, and more national programs. At this level, we must recognize the effort of association of persons with disability, the social society institution that work in the field of disability, and the Office of the Secretary of State for the Integration of Persons with Disability would do not stop working to respect the right of disabled people by also promoting their access to technical aid, in particular throughout the bank of adapted materials. But also we can consider other things, the lack of rehabilitation services that can lead us again to the lack of awareness of what rehabilitation is and who can have access to rehabilitation in the country. Also, we must consider the lack of products. When we say that all the products come that we use in the rehabilitation field or for the person with disability, all those products come from outside of the country. It is really, really difficult for a country if we consider all the materials that, all the equipment, all the devices that we are using, except the prosthesis and some split, they are all come from outside, and we can consider to have them made in Haiti with what we have, and that could also consider another product that is imported for the country. When we use those imported materials, it is the inaccessible environment. For example, a product that you can use in the US cannot use necessarily in our terrain in Haiti. That's another aspect. Other lack that we have is, for sure, is the lack of human resources. If we consider the amount or the quantity of professionals that we have in the rehabilitation field, is not really important, or the quantity is not enough for about 12 millions, 12 millions patients. There's less than 3,300 professionals. It's a lack of human resources. And also a big barrier is to finish that presentation is the financial barrier. There's no investment in the field of assistive devices in Haiti. For that reason, we encourage companies, entrepreneurs to invest in the devices and technology field in Haiti. If you have more questions now, Janet, I'm ready to answer.
Thank you, David. I have already a couple of questions that we will save for the end that will be relevant to your presentation. That's very good. Very good information, and very, as Dr. Payan, to use Dr. Payan's word, provocative questions about how we can get something going for our equipment to be available, and our education and our rehab professionals in Haiti. It's a good question, especially the entrepreneur part. So let's save that for now, and I will move along to, we have presentations from some working professionals. First, I'd like to ask Ramona Adrian, OT, ergotherapist. What do you do in your job, and why do you like your job?
Hi, Janet. Hi, everyone. Thank you for inviting me, and it's a pleasure to participate in this webinar. So, like Janet said, my name is Ramona Joël Adrien. I work for Respire Haiti in Gracier, and I'm also one of the first graduate of occupational therapy in Haiti from UNEF FSRL, and I am the secretary of IAOT. So I know Consuelo talked about what OT is and what an occupational therapist is. I'm just going to give you a few more information about them. So we will start with the AOTA definition. And I like how they put it. It's the only profession that enables people to do what they want and what they need to do through the therapeutic use of daily activities. And along with that, an occupational therapist enables people of all ages to live their life to the fullest by helping them promote health and prevent or live better with injury, illness, or disability. So to summarize what my job as an occupational therapist is, let's just say it's enabling occupation, promoting autonomy, and encouraging participation of a person living with an illness, injury, or disability. So if we want to talk about occupation, I know Consuelo talked about it. I'm just going to say it's the daily activities like eating, bathing, hygiene, jobs, schoolwork, leisure, family roles, all of that, and more. So for me, my job is what? My job, it's like, I'm going to give a couple examples. It's enabling a teacher or a preacher with a language limitation due to a stroke or another condition do their jobs. It's enabling a student with a learning disabilities do schoolwork. It's helping an injured athlete regain skills. It's helping a farmer or a saleswoman with low back pain engage in farming or selling at the market, tending to their pain and give them new ways to move and protect their body. It's providing support to older adults experiencing physical and cognitive changes. It's showing a stroke patient with hemiplegia how to use new ways to function around the house or at work or in their community, in their churches. So it just gives you an idea of how us as occupational therapists or ergotherapists, we help and we intervene in our plans. So sometimes occupational therapists, they create or make adaptive equipments like splints, orthotics, feeding tools, dressing tools, and so on to help the person better and engage in their activities. So our interventions are mostly activities like, let's say, obstacle course for children. Obstacle courses are fun and they're really engaging, so you can use them to work for strengthening, coordination, balance, etc. Or if we see more for teenagers or adults, we can use board games to work on cognitive skills or fine motor skills or anything else. So I work, like I said, at Respire Haiti, and I really love this place. It's a place where we can help the community at Bellevue Mountain in Gracie and beyond. Like there's a school with a special education program. We have a clinic with medical doctors, nurses, social workers, psychologists, therapists. Like we help the population according to their needs. So I personally work with special ed kids and also the kids that come into the clinic that are not in the school, but require therapeutic sessions. So along with my colleagues, we see kids, teens, and adults, and we have several sessions. We have individual sessions, we have group sessions, we have parent support group, and we also do educational sessions for the regular school students, the teachers, and the parents. So why do I like my job? I just want to leave space for questions and exploring more about what we do at Respire or what I do as a therapist. So why do I like it? I love helping people, and I'm creative and I'm crafty, and occupational therapy gives me the opportunity or a platform to advocate for people with disabilities or any other handicap. And I can be me, and in being me, I help people reach their full potential. So I mostly work in pediatrics, and I love what I do because I have so much love for children, and being an OT gives me the opportunity to help them grow and mature into the Haitian citizens that are involved in their community despite all handicap or limitation that they might have. So that's what I have for you, and if you have questions, I'm ready to answer.
Ramona, you making my heart warm. I'm going to ask to hold the questions until the end, but I think when you ask a person why they like what they do, that's when it comes alive what they do, what your day is like. Thank you, Ramona.
You're welcome.
Okay. Emerson. Emerson is a graduate also of FSRL. He is a physical therapist. He is the director of CUTA, Centre Universitaire Tête Ensemble, which is our student-assisted clinic, but he directs the clinic at Hôpital Sainte-Croix in Léogane. And Emerson has also invited one of his patients, Madame Silda Aristide. She is here to speak about what her experience is as a recipient of physical therapy services, what her experience as a rehab patient has been. And I believe that Ramona is going to translate for Madame Aristide when she comes along. So Emerson, can you speak to us, please? You can put your picture on. Maybe you can put your picture on.
Okay. Yeah, maybe I can't.
If you can't, that's okay.
Internet is not really stable when I
Yeah.
pin the video.
We can do just the voice. That's okay.
Good afternoon, everybody. As announced, my name is Emerson Barthélemy, and I'm a physical therapist and FSO graduated. I'm currently working as clinic director at CUTA, Centre Universitaire Tête Ensemble at Sainte Croix Hospital. My work consists mainly in doing the administrative tasks like making the clinic run, supervising students who come for the clinical rotation, and certainly taking care of patients. As physical therapy is a new discipline in the country, eventually at Sainte Croix also, part of my job is promoting the profession, educating nurses and medical doctors about therapy. Today, I'm putting the stress on what I'm doing for my patient. Basically, I see two categories of patients, the in and the out patients. For the inpatient, after the evaluation, I mostly work on prevention of joint and muscle contracture, preventing pressure ulcer, teach some bed mobility techniques to parents, and depending on the diagnosis, for example, if the patient has a stroke, I can start stimulating the patient neuroplasticity potential and so on. It really depends on the gravity and the diagnosis. And also I know vital sign is really important for that category. I sometimes perform some cardiopulmonary technique, things like this. In case of outpatient, for the first visit, I do an evaluation. From that, I determine if the patient really need therapy or do I have to refer that patient to another specialist. Sometimes the patient might need therapy, physical therapy, and I decide to refer the patient to a medical doctor. For example, here we always have a patient with a high blood pressure, and if it's a persistent problem, I might refer the patient to a specialist to stabilize the blood pressure. If the patient is qualified for therapy, I often do a trial treatment, which is going to be beneficial to my intervention plan in the future. And it gives immediate relief to the patient also. We see different population. We see pediatric, geriatric. We also we also see different diagnoses, stroke, fracture, from motorcycle accident, most of them. Arthritis also, we have so many arthritis cases. For me, nothing has been more important, more joyful than having the chance to heal my community with my hand through my loving profession, which is physical therapy. Seeing my patient coming back in their activity of daily living, adding smiles to their face and adding life to their days. There is no word that can describe my happiness. I mean, it makes me very happy to have that chance. I love that profession because it makes me help people live a better quality of life. And I have with me today a patient. I'm going to introduce you to her. Her name is Zilda Aristil. She's going to talk to you about her experience with therapy? How has that been from the beginning until that moment that we're talking? We're gonna have Ramona translating for Madame Silda. Ramona, please, can you translate for Madame Silda? Okay.
I'm here.
Bonsoir. Moi,
Good
c'est
afternoon.
Silda Aristide.
My name is Hilda Aristide.
Oui. Haïtienne, léoganaise.
I'm a Haitian from Leogan.
Okay. Moi, c'est un patient qui t'a suivi thérapie dans l'hôpital 7 Croix, dans monsieur Emerson. Comme dire, moi, j'étais vraiment content jour où tu parlé de thérapie dans l'hôpital ça.
Okay,
Mais
I am a patient.
avant tout,
I'm a patient at Utah, and I was very happy to hear about the program and the rehabilitation service of Hôpital Saint-Croix.
avant tout, il y a quelques personnes qui te voulaient faire peur, ça qui te les thérapie, parce que moi pas connais ça. Pas connais du tout si tu as un programme comme ça qui te les thérapie pour monde qui te fait accident. Ça t'est arrivé moi la première fois me fait accident, moi t'ai souffri en pile, mais c'est parce que me pas connais programme ça. Mais heureusement, une deuxième fois me fin tomber et puis orthopédie ça t'ai référé moi l'hôpital 7 Croix de Léogane. Et puis c'était vraiment merveilleux pour moi quand t'ai arrivé l'hôpital ça. Ça t'est pour moi t'ai croisé avec monsieur Emerson pour te parler de thérapie, pour te faire me connaître qui ça qui thérapie. Et puis
Okay.
thérapie.
Moment. Madame Aristide, faut s'il vous plaît. Merci. Some people like try to discourage me or have me be afraid of therapy because I didn't know what it was. And then I had my first accident. I was in a lot of pain. And the second accident, my orthopedist referred me to Hôpital Saint-Croix Rehabilitation Services. And it was wonderful to meet Mr. Emerson and to have him work with me. Madame Aristide?
Oui.
OK, on est capable de continuer.
Oui, merci. Le moment où est arrivé à l'hôpital là pour la première fois, ça qui te fait me content, c'est façon de accueillir moi dans le programme ça. Et puis ensuite, moi j'étais avec un béquille. Premier jour j'étais allé, moi j'étais un béquille que moi pas très main. Mais moi j'étais venu content rapidement parce que monsieur Emerson était venu faire me connaître, on pas prendre trop de temps avec béquille. Béquille chaque fois m'avait comme si il fait me sentir moi malade plus. Mais cependant c'est pas vrai non, mais l'aime vinn comprendre qui ça qui thérapie et puis monsieur Emerson a ban moi notion yo. Il a expliqué bon la bon moi exercice que moi dois faire et puis les dit comme ça madame Silda ou pas prendre trop de temps non sous béquilla ça te fait plaisir elle te dit ça effectivement deuxième rendez-vous me te gagné pour me aller côté monsieur Emerson les m'a pour retourner la caille moi les fait me tourner sans béquilla ça te fait plaisir et jusqu'à présent c'est ça qui fait bien un petit moment qui différent avec première fois me fait un paquet de temps à souffrir avec un béquille dans mes mains et tandis que non on titan me déposer béquille ça te fait bien ça qui fait me content encore me te vinn ouais thérapiealité pour moi yo formation me te prend formation là donné qui te non seulement t'aider mais t'aider avec l'autre monde tout nous devons comprendre dans thérapie li pas seulement pour monde qui malade ou te doit pas sentir malade mon besoin thérapie nous devons comprendre l'aime te malade dans genou certainement mais l'aime faire thérapie li pas seulement pour genou nous réaliser thérapie t'es bon pour tout comme me sentir bien l'aime faire thérapie et chaque fois moi estime que on séance pour le finir, pour le venir l'autre séance, moi content, les moi prendre séance ça venir après parce que me senti thérapie a aidé moi pile. Non seulement aider moi même sanitairement, aider moi, me senti comme tes besoins ça ce que mon pas connaît, pas connaît ça. Même ça tout comme tes besoins yon chose pareille.
Okay. Lydie could, oh, sorry. Sorry. She said that what really helped her, it's like the first time Emerson greeted her into the clinic, and he did it with such warmth that she felt good. And she didn't like the crutches that she was using. And Emerson told her that she wouldn't take a lot of time to put those down, and that helped her feel better about herself. And Emerson explained to her exercises and how to do them, and that really helped her also. And the second meeting, she went back home without the crutches, which really helped her and made her happy. She said that for her, therapy is not just therapy, it's a training. It helped her and it helped other people around her. And she realized that like knowing better, understanding better how therapy works, you might not be sick, but you need therapy. Like she had a knee problem and she needed help with a lot of other problems with her body, and coming to therapy is really exciting for her. And after each session, she waits for the next session, and that makes her excited. Thank you.
Okay.
Okay. Thank you so much. Now, if you have question, I'm ready to answer.
Thank you, first of all. Merci en pile, Madame Aristide, Madame Silda. Madame Silda. Merci beaucoup. J'apprécie beaucoup. Thank you, Emerson. I want to make sure we have time for one more presentation from Dr. Yvens Luyus, and also I want to return to Mario and have him talk about the association. So let's go with Dr. Yvens Luyus. Oh, and I have one more thing to say to you, Emerson, as well. My heart is also warm. Very warm. Thank you. Okay, Dr. Luyus, I would like to present. Dr. Yvens Luyus is unusual in many ways. One way is that he is OT and PT. He's certified in both professions. He has his doctorate in rehabilitation. He is the founder and director of Fondation Haitienne Nationale de Rehabilitation au Fond Hare, which is in Wanaminthe. He has a community-based program in Wanaminthe, and I would like you to talk to us, Dr. Luyus, about what is community-based rehabilitation, and at Fond Hare, how do you do community-based rehabilitation?
Hello, everybody.
Hello.
Yeah, so it's a deep honor for me to be with you, and thanks for Haiti Health Network for coordinating and organizing this roundtable. So to share about this important topic about the rehab in Haiti. First of all, Barbara, I would like that you give me access to share my screen.
Sure.
I would like to have access to share my screen.
Okay, I will do that for you.
Okay, yeah. So as Janet said, my name is Yvens Luyus. I'm the founder and current director of FONARE, is the Foundation for Haitian Rehabilitation. So FONARE was created in 2011 with the express purpose of integrating disabled people into society and to do prevention and to do handicap prevention.
Dr. Yvens, if you hit share screen, you should be able to share now.
Okay, great. Thank you.
But we're not seeing you yet, so I just want to let you know.
Thank you. Okay.
Now we can
okay, so as I said, that FONARE was created in 2011, so with the express purpose of integrating disabled people into society, as well as to do handicap prevention. And since then, we have moved forward, and in 2015, we're able to create an extension board in the US, and then we have the 501c3 status in the US as well in Haiti and in the US. And also, it's more than only a rehab center. It's also an international continuing education facility, because we host a student for internship in PT and OT from one university in the States, and one in Belgium, and 5 in France. So they do their internship in physical therapy and in occupational therapy here in Fonare, and with the supervision assured by the local competencies. So on our long-term vision for Haiti, we say is crystal clear, because for Fonare it means providing a better quality of life for children and healthy families, inclusive, resilient society, and last but not least, providing the resources to promote flourishing communities. So, talking about Fonare's activity and work and achievement should be a long presentation, but I opted to skip and drop over and fall on the community-based inclusive program, just to talk a little bit about only this aspect, this work of Fonare, the community-based inclusive development program. And then if someone needs to know more about us and what we do, at the end of the presentation, we will share all the information and the website. So you can go in the website, you can see everything. Also, you can follow us in our Facebook page, in our Twitter page, Instagram, and YouTube. So there's many ways you can follow us to get to be familiar with what we do and learn more about us. But now we just skip over and then talk a little bit about what we do in the community-based inclusive development program. So the brief purpose of this program is to create socially inclusive and responsible families and communities, and entrepreneurship empowerment for disabled people and vulnerable women in the northern of Haiti. So to just mention the first part is to how to make the family socially responsible, socially involved in our patients. So now you see the first aspect. In our clinic, we do clinic sitting treatment, also community services. So the first one is the home visit and training. So what we do is we go home, as you can see on our way going home. This is our driver. This is me with the hat. And we do the community service in this 3-wheel motorcycle. It's our small truck. So what we realize is how to get family involved to become actor in the patient recovery. Because when we work at the clinic, only at the clinic, so we realize that the recovery process is longer. But when we work in collaboration with the families, so we realize that our patient go forward more faster. So they get the recovery is faster. So when we go home, we train the family member how to be involved, how to be an actor of the recovery. And then we also evaluate the direct environment of this patient. So we go home, we assess the house, see the accessibility, the space for the space for moving inside and in the yard. So if there's any need to make adaptation, if there's a need to build the ramps, so we build ramps at home to make the house accessible to the functional level of these specific person. And then we can adapt the bed, adapt the living room, adapt the space, so that the patient, our goal to the based community-based inclusive program is to improve the functionality of our patient. So all they can improve their potential at home, and not only at home, but you will see even forward in the community. So I have some pictures with our staff, some local staff, volunteers, and students, and foreign students involved in the community work. So, and the part of the work, not only you go home, you work with the family, and then you train them how to do exercises at home. You train them how to do safe transfer. You train them how to be more proactive in the recovery. But you also enjoy the deep feeling with them. You see, now this is our occupational therapist volunteer. So helping, teaching a patient with stroke how to peel a mango and eat it. So when there's some small thing that you go at home so the patient feel more useful for himself and for his family, and that help emotionally in his recovery. So we work in many single thing, but also going home help us to know the home environment. What is the situation socially? Is there any conflict at home? Because some conflict at home will decrease the recovery and the progress of our patient. So we work to know everything about the close environment of our patient. That is the first purpose of the community-based inclusive program. But this is a very complex, this is the most complex and comprehensive program in our organization, our foundation, because we're not only working to go at home, but we see everything that is involved to our patient inclusion, to our patient participation into society. So as the main purpose is to create a socially inclusive and responsible families and communities. So we see how we can make the families socially inclusive and responsible. So to do that, we advocate. We advocate for inclusion into society. We conduct awareness campaigns in schools, in churches, in communities on respecting the rights of people with disabilities for an inclusive and resilient society. So we go at home because we realize that when you talk with the adults, it's difficult to make the change. You make the change more, even more quick when you do it with the young, with the student. So we go at school, and then the school, when the students know that, Daddy, do not treat disabled people like that. So the adult catch the message. But when the adults say to their children, it's more even harder to catch the message. But we teach at school, we teach at churches and public communities. And today, over 100,000 lives have been touched by the promotion for an inclusive society in the northeastern region of Haiti. Because that is one of the aspects we need to change: negative attitude, negative behavior about disability, about disabled people, and to have a more inclusive approach. But the other aspect that
Dr. Louise?
Yeah, yes.
First of all, this is extremely important stuff. I think we need to have a longer presentation on it because it's very important to understand the context for people that are in conditions of disability. Our time is coming to where we need to hear a little bit from Mario and then open for questions. I hate to cut this off, but I know you are a good teacher and we could have easily a day worth of presentation. Do you want to have one more last word before we bring Mario on?
Okay. Yeah, so let me give the end. Yeah, so but now we just see the negative impact of COVID-19 on in the functioning of the center. Now, since March, we were closed for the COVID-19. Then we just tried to reopen now in this July month. But but the big challenge we are facing after the COVID-19 situation is related to funding to provide the services. But in our facility, we are seeing more than 60 patients per day. And then our staff was 25 staff, among them 7 are people with disabilities, total staff. But now we have to cut the staff to 70. Only 30% of the staff is working. But now we can't meet in only 3 weeks since we opened the services. We have a lot of patients that cannot receive them because mostly our 75 of the operation of the service was being sponsored by a partnership in the US. It's a rehab company in the US that were sponsoring part of 75% of the budget for staff, for salaries and operation. But they are heavily or deeply affected by the COVID-19 as well. And then since February, we are talking that they can no longer support the funerals work in Haiti until the situation change. So we just open and then, but we just open by faith. But now we don't know yet if we're gonna close again, not for COVID, not even for the direct COVID, but for the negative impact in 1 month, in 2 months, in 3 months, because of the specific situation or that the funding situation that is affecting to provide the services.
Could you put that at least one of those contacts into the chat so that people can follow up? I know you have it here. If you could also put it into the chat message.
Oh yeah, I can
for the attendees as well. Thank you so much.
Yeah. So.
And let's now go with.
Thank you very much. I am really sorry that I didn't have time to do the presentation. It was really short, but I am really sorry. But thank you very much for the invitation, for inviting me.
Events, we already have a request for you to do a full presentation on the side chat. So people are asking for more, so I appreciate that. That's good. I would like to call on Mario Pasque because he got cut off before by his internet. Mario, if you could just finish your presentation. You were going to tell us what is the work of the Association Haitienne des Assistants ou Aide des Techniciens, no, Thérapeutes Physio, it's a long name. You can tell what they do, and you had some international connections.
Okay, so for people who didn't hear me first, so I'm the representative of Association Nationale of Technicians of Rehabilitation. So we have been created in 2013. So our mission is to promote rehabilitation also and to work with people with disability. So as work we have done in the association, so we try to gather it together, all rehab technicians, in order to work and to promote rehabilitation. And also we used to participate in WCPT in 2017 and 2019 and the Congress to talk about the association and to talk about what we have done during our existence in A. So we used to do awareness activities on some pathology because we know there are a lot of people in Haiti who don't know the pathology they can have. So we try to do some awareness activity and as a communal and some school and also in some area in the capital. And also we work in collaboration with other associations in the field because we have some partnership with some when we do some activities. And there are some many technicians who are not working in order to postulate when they get opportunity. So, but as challenge we find in our association, so we get some difficulties because there are we have technicians after have been learning, they cannot find job because they are not so much. We have center in the capital, and also we have technicians who want to continue our study, and they don't have enough school because right now we have 2 universities in the capital that train physical therapists and ergotherapists. So there are we have technicians who want to continue their study, but they say they don't have enough money to go to the university, or they cannot afford to pay that. So they suggest, so during 1 year we can have 2 or 1 scholarship for those who want to enter in the university. As challenge also, there are some patients who work in the center don't have a good payment because we don't have a standard payment for those who are technicians. So they work very hard and they need to pay well in order to do the job, but unfortunately don't have a good payment. And also, as you know, all people here, you know that the government didn't recognize yet the profession in Haiti. So we want and we need to make so much pressure on them in order to recognize the profession in Haiti.
So
sometimes we need to realize some activities, but do you hear me?
yes, I do hear you. And I want to say that where I have met Mario is at the Table Sectorielle, which where I met most people, but it's the rehab organization of the country where people from all aspects of rehabilitation come together, and a lot of that work has been focused on how to request formal recognition by the government of Haiti for the rehabilitation professions. And I think the associations are central to that. I'm very appreciative of the people that are building those associations, building the voice of the practitioners. So thank you, Mario. Thank you very much.
Okay.
We are ready for some questions. I wondered if Sabine wanted to say anything before we start on questions, and we have maybe only a few minutes for questions. I suggest that we can answer questions afterwards. Also, we can share written questions and send out some written answers. I think there's a way to do that. But Sabine, do you have anything you want to say before we start in on questions?
I would say let's go directly to questions. I think there's a lot of interesting questions out there, and yeah, I'd like to give people the chance to do that.
Okay, thank you. We have questions. If you look at the bottom of your screen, Q&A, there is a written question. A couple of questions have been answered already, but there's one here, Antoine Carlo Joseph. Can you ask your question?
I'll have to turn him on.
Oh, I'll just read it. I'll just read it then.
Yeah, good. Everyone's muted by default.
We do have the law and the articles are clear, but the problem is that the law is not respected. Is there any way to help the representatives of the government in this way? Should this law be taught in school? Physiothérapeute Joseph. C'est important pour enseigner cette loi dans les écoles. C'est possible. Dr. Péan.
Well, I think it's very important. You know, this question is very important. Effectively, we should introduce the Haitian law regarding the rights of the disabled to the university and also to the public school in general.
Yes,
but,
very good.
I would like to, I don't know if I can do that, I would like to make a comment about the presentation made by David.
By David, okay.
Yeah, he made a very good presentation. He mentioned that in Haiti we have some barriers, such as the lack of awareness, the lack of human resources, the lack of financial reports, financial resources, But I agree with that. But he forgot to mention that in Haiti in general, we do not have public policy on rehabilitation. And personally, I think the Ministry of Health, in partnership with the Ministry of Social Affairs, should try to develop public policy on rehabilitation, including the community-based rehabilitation. Okay. With that policy, I think in the future they will be able to recognize the rehabilitation professionals.
Yes, that's very important. I hope we will be able to do that. David Charles, we had a question about how do people in the country access the Adaptive Equipment Bank at Bset?
It is a simple action. There is 3 ways that people can access the bank of adaptive materials. Is firstly, personally, as a person with disability, the person can come to the office, either in Port-au-Prince or in the departmental offices, to get an assessment and receive the materials by the organizations, and also with the rehab centers. We work in these directions, and otherwise you can connect with the Office of the Secretary of State.
Okay.
At this address that I will put the address in the chat comment to let everyone has access to its info at seiph.gouv.ht. I will put it later on after the answer.
If you could put that in the chat, that would be wonderful.
It's possible to save the chat. If you look at, on your laptop, if you look at the chat at the very bottom where you type in a message is a box with 3 dots. If you click on that, you can get save chat, and all of that material will be saved to your laptop.
Yep.
Thank you, David. The last minute is for, we have on our program to hear again from Barbara about what is the, how can we marshal all these resources and have people have access to them?
Yeah, well, first of all, before I do that, I just want to say thank you. I mean, you guys did an amazing job of giving an overview of the work and all the resources available, and also the heart behind it. I really appreciate it. I mean, my children are old, but I just have to personally share the role of therapy in my life. My children were born 3 months premature, and my son had some severe disabilities. We had PT and OT in our life for over 5 years.
Yeah.
In our home, just like y'all are doing in Haiti, we had it here, but I mean, it was a huge blessing. So I think y'all know how important the work is that you're doing and the lives you impact, but I just wanted to just reiterate that from a personal perspective, because I mean, it's crazy you forget, but man, that was a huge deal for us, and it really changed my son's life. So thank you guys for what you do. And I'd like to learn more about the efforts to get all this recognized as official professions. That has to be huge for your work, and help advocate for that. Please let us know. Regarding the resources, we definitely, there's already a list, there's several lists started. So I will work with Janet and Sabile to make sure we get everything in one place, and I will send it out to everyone via emails. I did also want to make everybody aware of a resource that exists online already. I don't have the ability. You're still the presenter, Dr. Evans, which is okay because we're near the end. It's fine if you can't switch back to me. But there is a website that we put together called relinkglobalhealth.org. I did type it into the chat and I can email it out to everybody as well. And it is a database of all healthcare services in Haiti. And our staff is ongoingly updating that data. But one of the categories is special needs and mental health. You click on that and there's a directory of physical therapy, occupational therapy, prosthetics labs, services for the hearing impaired, the visually impaired on this database. I will humbly admit it's not 100% accurate and we'll need to add in a lot of resources that we'll especially learn about today. But it is an online tool that can be searched in French and Creole and English to help with this. And so we'll aggregate the list, we'll send it out via email, and then we'll also enter it into the database so that everybody can have access to it as well. So I will commit to doing that as the follow-up for everyone. Type that link.
I think we're at the very end. I want to say a million thank yous.
Yeah, thank you everybody for participating. And we will send out the follow-up. I'll edit the video and we will, the recording, we'll send it out to everybody that you can share, listen again or share with your colleagues. And then we will also aggregate that list of resources because I think it is really important that people can connect to these resources. So everyone, excellent job.
You had said we may send out notices about a Creole network.
Yes.
Similar webinar.
I'd love to do this again in Creole.
Yes.
And then allow some of the presenters to go into much detail into their work and even be a little bit more technical or clinical. So we want to do that as a follow-up maybe in August or September. So we will stay in touch with everybody about that as well.
Thank you.
Janet, anything else you'd like to say? I'll give you the last word.
Celebrate. That's all.
All right. Thank you, everyone. Have a great day. Appreciate y'all.
Thank you, everyone.
Thank you, Barbara. Thank you, Janet. Thank you, everyone.
Thank you.
Bye. Thank you, everyone, for listening.